Right. Well, again, good morning, everyone, and thank you for joining us today for the School-Based Health Center's virtual coffee and chat featuring our amazing Paul Danicic and Kari Hentges. And before I kick things off to them, I thought I would just share a little bio for each of them so that we get to know our speakers a little bit better. Beginning with Paul, in his role at Nicollet Foundation, Paul manages partnerships for our community programs and community collaborations, mostly but not all focused on youth. Paul enjoys working at the nexus of education and healthcare, as many of our initiatives happen where students do life at school. Our partnership programs have been shown to increase access to health and reduce barriers to learning. To Paul, this brings equity and much needed health and mental health components to youth development. Before coming to Nicollet Foundation, Paul was executive director for regional environmental, nonprofit, and also YMCA Camp Minojin, a wilderness expedition camp in northeastern Minnesota. In that time, Paul worked to improve the lives of young people and increase their connection in their own self, others, and the natural world. And then for our second speaker, Kari Hentges, in her role as regional director for primary care, Kari supports 8 primary care clinics across the organization and the 4 school-based health resource centers. Kari has her MBA and a master's in counseling psychology and has been with the organization for 21 years. So Kari and Paul, thank you so much for joining us today. And without further ado, I will turn my camera off and let you guys kick things off.
Thanks, Abby. Wonderful introduction. Really appreciate it. Hello, everyone. My name's Paul. I'm working here at the foundation, and I'm going to start us off. I want to just give a little bit of context. So our mission at the foundation is to improve the health and well-being of patients, families, and communities. And we do that through partnerships and philanthropy. And what's, I think, really important and really accurate is that we use that word partnership because we see all these things as partnerships. I hope you'll see that through the rest of the slide show that we do. And then for more context, we're the philanthropic and volunteer arm of Nicollet Health Services. So we have the volunteer services in with our team, which is really unique and also really wonderful because they do excellent work and add a lot of value to our entire health system and the services that we provide. So we, as a foundation, we support not only Methodist Hospital, but also all the care clinics, the medical specialties and specialty centers. And that's also unique in our world of sort of hospital foundations. In 2023, we raised about 7.2 million, a little north of that, and we provided 3 million in support. Most of that goes to the improving patient and family experience here in the hospital and in the clinics. But another difference for Nicollet Foundation is, with this 1.5 million that goes into the community for health support. So we have most of that support in the community. We have our partnership programs with mostly school districts, and these include 3 what we call our signature community programs, which include the school-based health centers. We have a No Obstacles to Wellbeing, or NOW, telemental health program, and Growing Through Grief. And if you'll see, those don't just happen alone. Those are partnerships with departments in Nicollet Health Services. So like today, we're focused on the school-based health centers, which are primary care, which Kari represents. But our telemental health program, we partner with behavioral health to provide that. And our Growing Through Grief program, which is in 16 school districts and serves like 1,000 kids every week, that's a partnership with hospice and the school district. So I just wanted to give that context. So there we are. There's our partnerships. The close partnership that requires, these require close partnership because we're working with school districts, and so school districts work under some different regulations than healthcare, and a lot of times we have to work through those things to provide care for the students that we see. I'm going to turn it over to Kari to get into some details about our school-based health centers.
Great, thanks, Paul. So we wanted to start with an overview, just to orient you a little bit to the work that's going on with the school-based resource centers. So at these locations, we are providing medical care for students in the district. They really can be anywhere from birth to high school graduation. And we're doing that right now for students at no cost to them, to help support that need. The 4 different schools that we partner with are Brooklyn Center High School, Burnsville, Richfield High School, and St. Louis Park. And in 2023, we were able to provide direct care for just over 1,600 individual students and address just under 2,000 healthcare needs within those students. You may be wondering how a school-based health resource center fits with work that is already happening every day by the wonderful school nurses within each of the schools. And this is a great slide that outlines some of those differences, but also how they are very complementary. So you can see in the upper left circle there for the school-based health centers, we're looking at providing primary care, mental health care needs, helping to support sports or physical exams, immunizations, and other care needs that might be coming up as well. And school nurses do a lot of things far beyond what is listed on here, but some of them to call out are looking at screening for barriers to learning, triaging accidents, illness, supporting medication needs, and they are an overall just wonderful partner in student care, especially if a student has a medical need that they're navigating while they're at school as well. So together we have an opportunity to really help support overall student success. And that is really done by education within, again, both of these venues and helping to support the well-being of student health, academic outcomes, and well-being. And some of that comes from reducing ER visits or hospitalizations, but also allowing them to be at school and focus on school because we are hopefully helping to support addressing any medical care needs that are coming up for them and hopefully doing that early on before they are increasing into something more impactful. School-based health centers are often acting as a student hub, and we certainly see that within the 4 school-based health resource centers that we operate within Park Nicollet. So we are focused on, again, delivering that medical care, but also see our school districts are partnering with others to best support the overall needs of their students. So Children's Dental is often providing free dental care for students in these districts. Many are partnering with Portico to help them navigate insurance options and opportunities that could be available for them and their families. As Paul mentioned earlier with the NOW program, mental health services continues to be a very high need with students across the nation, but certainly within these districts as well. And so helping to make sure that we are providing access and coordinating that care. And then also looking at opportunities for health education. And that really happens in every encounter that we're having with students. There's an opportunity to help support them in their own health education and awareness and helping them become drivers of their health and well-being, especially as they are, some of them are entering into that older adolescent stage and having a little bit more independence and soon having even more so. And so helping them understand, questions to ask, how to seek medical care, and the importance of doing so. And then another component to highlight is vision care and how that is also a piece of this hub. We are fortunate that we are able to partner with the eye department within Park Nicollet on meeting vision care needs for students in these 4 school-based clinics. And we have great processes in place and partnerships in place with our eye partners to help support that need. And so if it is identified that a student may have some challenges with their vision and may need further evaluation, but has barriers in seeking that care, maybe financial barriers or transportation barriers in getting there, we're able to help support that need. And so we have a process where we can refer them to our eye department. And if it is determined that they do in fact need glasses, there is a selection of glasses that the students can actually choose what they would like to have and be able to have those free of cost, again, in partnership with the eye department and the foundation. And this is a really important and core piece as you think about early learners. We want to reduce any barriers that we can to help support them in reaching their full success overall. And so this is an important one for us to be able to continue to do and support to partner with the schools and with the students in meeting that need. This is a list of some of the most common needs that we are addressing within the school-based clinics, but certainly there are additional things that come up that we are going to help support as those needs arise. Immunizations is a big one, and especially at this time of year as back to school season is in full swing, and helping to support any immunization needs that students are having. And so this is a great opportunity for us to partner with school nurses, especially if they might be identifying students who don't have necessary immunizations and helping to meet those needs so that they can start and remain in school and focus on what they need to do there. We do see a little bit of differences within needs based on where the school-based clinic is located and the population served. And so you may have noticed on one of the earlier slides, 2 of the school-based clinics that we help support are located within high schools. So Brooklyn Center High School, as well as Richfield High School. And with where those are located, we tend to see that older adolescent population. And so our serving needs there more around sports, physicals, sexual health needs, pregnancy prevention needs. Whereas at Diamond Head, for example, that is the school-based clinic within the Burnsville district, we are in an education center and a welcome center. And so we're seeing a lot more of a younger population, a very young, young children, many of whom are actually new immigrants to the country. And we are supporting a lot of really important needs around immunizations and well-child visits. And all of these are very important in helping to support the overall health and well-being of students and also allowing them to focus on what they need to in school. But important just to see what those differences might be based on where the clinic is located. We have awesome team members, leaders, clinicians, support staff, team members that help support the work of the 4 school-based health resource centers. So we have family medicine physicians, nurse practitioners, physician's assistants, our leadership team and nurses, and then support staff, which can include our clinical support staff as well as medical receptionists. And each has a really important role in helping to welcome students and families into the clinic, as well as supporting the care needs of the students while they're there. And we are very grateful for the dedication that this team has for the school-based clinics, but also important to note that this is really fulfilling work for them as well. And so it is a highlight for them in their day, and in some cases, a really great recruitment tool for us because people really value that, that focus on community and helping to support that need. As Paul started with, a lot of this is really based on partnerships, and that is true across the board, and certainly a value for us as an organization that lives out in the work that we have with the school-based clinics. So wanted to highlight a few other components of the school-based clinic beyond just that medical care that is probably more expected within the school-based clinic. And that is supporting other needs. So we are able to support medication needs that our students might have. We have a partnership with Cub and a formulary that we're able to partner with our pharmacy partners within our organization on to ensure we're following evidence-based medicine and best practice, and are able to provide a voucher for a student if they do have a medication need, to be able to go to Cub and get that filled. And so that is not a barrier for them. And that is something that we continue to evaluate and look at to make sure that we are best meeting the needs with our students within the opportunities and resources that we have. We also want to make sure that we are in compliance like we would be with our regular clinics around quality pieces and consistency and processes. So that is something that is important to call out because that relates to the quality of care that we're working hard to provide. And then wanted to really highlight a lot of really wonderful opportunities for primary care and student and school partnerships. And these are just a couple of examples, but really exciting ones and impactful for students in their lives. So within the St. Louis Park School District, and most recently also with Hopkins, there are programs for students while they're in high school to go through a nursing assistant program and to then go on for employment in a nursing assistant role. Part of what is required for that is for students to get their Manto test. And if you're familiar with that, there's kind kind of 2 steps to that process. One would be you're getting the manto, and then you're going back about 2 or 3 days later to have that read. And we are able to do that within our central clinic, within the school clinic within St. Louis Park, to both administer that and read that when they have had that 2-day period. And so this is really helpful because we are located just down the street from the high school at St. Louis Park and are able to provide that free of charge for students who then are going on and seeking employment in nursing assistant programs. This also is an opportunity as an organization where we can help them connect with positions if this is an organization they are interested in and in working in. So there's a lot of benefits for that, both for us as an organization, but also for the students and for the school, and helping that program be successful by removing the barrier for that manto. Another piece that I wanted to highlight is great collaboration with marketing classes. And this has happened in several of our school districts where we are wanting to make sure that we have really good awareness for students in understanding what is available for them with our school-based health clinics, and knowing that they can access it, feeling assured that it is confidential. And I think having peers communicate that has been far more effective than anything that we would be able to do to meet that student need. And so we've had some really wonderful partnerships with teachers of marketing classes who are willing to have this be a project for students and to really look at, like, how do we help support student awareness so that they can feel comfortable in seeking care when those needs arise for them, and have seen really wonderful progress in increase in students seeking out that care when they have those care needs. And again, just really have found that to be so effective when it is coming from within their peers and they're identifying what talking points are going to be most important and impactful for their peers, rather than what we may be thinking is important for them to hear. So that's been really wonderful to see. And again, just a wonderful opportunity for them to take this as a project and really market it as a business with benefit overall. There also are some student mentorship opportunities. I know this was something that the St. Louis Park Advisory Board had really helped support in how do we create some opportunities for students that might be interested in healthcare and learning a little bit more and having some mentorship and even participating on the advisory meetings that we have. And so we do tend to see student participation on the advisory board meetings, and each district has their own advisory board meeting. They all look a little bit different just based on who is involved within that school district and how long they have been around, but great engagement and partnership there. And it's really, really wonderful to hear that student voice in that venue to bring up questions or concerns or ideas that might not be top of mind for us. And having that student voice is just immensely impactful. And lastly, just wanted to touch again on the education piece, because I think that happens in so many different interactions and is really impactful. We have a lot of opportunities where some of our team members or our clinicians who are providing this care will actually partner with health education classes and go in and do presentations, also helping to support that connection again with the school-based clinic, and helping students feel like that is accessible for them. And they're familiar enough with it to be able to seek that out, but also really touching on some important health needs. It might be related to sexual health needs or safety health needs. And so a wonderful opportunity for us to help build that partnership and also support that education for students. And again, I think another piece to really emphasize is the ability to help support them with education and really navigating their own healthcare. Many of these students are going to be transitioning into adulthood relatively soon. And so feeling like they have had the opportunity to connect with a health professional who's not only meeting their health care need that they may have come in with, but also helping to support them with how do you do follow-up, and what is the importance of follow-up, and how do you seek out healthcare again in the future should you have another need that is arising. So with that overview of what we're doing and some of the partnerships that we're having, I'll hand it over to Paul to talk a little bit more about benefit and impact.
Thanks. Well done, Kari. Y'all can see why I work with Kari here. You know, so I want to talk a little bit about the benefits that our school-based health centers provide, and also some context on that we're not the only school-based health centers. But really, the gist of it is that if kids are healthy, that they can focus on learning, and so the idea is just to remove all those barriers, as Kari was detailing. We also did a study with Health Partners Institute back right before the pandemic happened, and we actually asked the educators in the school districts where we have our school-based health centers and what they thought about it. And they overwhelmingly believed two things that I thought were pretty important. One was that it helped their students' ability to learn. And the second piece, which I think is just as important, if not more, was that it engaged their students with their own healthcare. Kari was just talking about that at the end. That's really important because that provides benefits for life, and it helps them stay healthy throughout their life. So some of these kids don't have the same sort of parental assets that maybe you and I had growing up, where we were taken to clinics and we got used to seeing a doctor or an orthodontist or a dentist, and they need to learn that. They don't have that map, and having a school-based health center right there where they're doing life can help provide that. And especially our doctors and our clinicians and support staff working closely with the school health staff get to know the students and the vibe of the school, what's important to the school, and can fit in with that community. That's really important for kids. This goes on to provide continuity of care for families and communities which are experiencing barriers. So, for example, transportation, homelessness, or near proximity to homelessness. They have gaps in healthcare coverage. The pandemic, threw a wrench in that works pretty severely. And all of us were playing catch up to get more immunizations for kids. The schools, were asking us to provide more to make sure that their kids were healthy when they're in their class. And the other thing here is that our providers are experts in providing education and helping coordinate care. So a lot of our visits, our school health visits, will wind up with referrals. For example, mental health. Like, we don't provide mental health therapy in all of our clinics. And one of them we do. We have the Now program located there. But oftentimes, if a student comes in for mental health reasons, that clinic can help get them on the road to getting the therapy that they need. The other thing I wanted to say is that national evidence it's all there. There's plenty of data on how school-based health centers really help the whole community. They help kids' ability to learn, and so I'm not just saying that through our study. It's national data that we have. They're not new. They've actually been around since the 70s. They just haven't been available outside of some of the inner city areas. And that's exactly why we got into it, was because these suburban areas were having some of the same student health issues, but not the resources that the inner cities schools could get. Anyways, thanks, Kari. We can go to the next one, I think. Right. So we've got here. Oh yeah. How it helps it helps lower emergency room visits and decreases costs because kids are getting care earlier. They're getting referred faster, and they really prevent a lot of these things that we're seeing in a lot of our urgent cares and emergency rooms across the metro area. Lastly on this is that we do training oftentimes in school-based health centers, and that really helps the recruitment efforts. Kari touched on this. We're not the only ones who are doing it, but an example is our Creekside Clinic is an actual learning clinic for all of us in Park Nicollet. and they provide the St. Louis Park Central Clinic care. And also a bunch of our clinics are partnering with St. Thomas for their nursing program to do placements to give them a community side of their nursing work. So we partner in those ways too to have additional benefits to the communities. Right. Lastly, these are made possible 100% by philanthropy. We're kind of the only model doing that. What's cool about this is like 100% of a donation towards these things go right to providing that student care, because Park Nicollet Health Services provides like Abby and Kari and I's salaries. So the money is going directly to, like, we work partner with primary care to provide that care. So it goes right for the doctors and support staff salaries. And we've been partnering with school districts. St. Louis Park started back in '96, and then we've sort of added the other three over the years. I think the latest one was like 2015 in Richfield. And so we know these communities really well. They rely on us, and sometimes their needs have changed throughout, but we're meeting monthly during the school year with our advisory meetings and our advisory groups composed of school leadership, community members, our staff, our medical directors, so that we can respond to the needs. We're still seeing a majority of students that have no insurance or are underinsured. So these clinics are not designed to be primary care for them and their main clinic, but they are there to fill that gap. And we're also seeing a lot of new to country families. And that becomes very complicated because where you and I could walk in for maybe an immunization and it's all sort of online already, and the healthcare staff there know what to do and know which immunizations to give us. A new to country family may have to go through literally an hour or an hour and a half of documentation and questions and also translation. So that really can be a lot more involved. So because those needs, like, we're not answering all of the needs. We're helping a lot of kids, but there's plenty of need out there. And so we're always looking for future opportunities for sustainability. And with more kids on insurance now, we're looking at maybe possibly billing, which we haven't done in these clinics. Of course, that would not change the healthcare being no cost for anybody who needs it, but it also helps to maybe decrease the percentage of philanthropy needed to run these. But yeah, we're seeing from all accounts from our superintendents and our school community members and our families that these programs really help the entire community. It impacts the school, certainly impacts the students, and helps their ability to learn, keeps them in their chairs, improves attendance rates, improves graduation rates, which is a major social determinant of health. So that's kind of why we do it. With that, I will end. And Abby, how do we want to do the questions and answers?
Oh yeah. So everybody, thank you, first of all, Kari and Paul, for your amazing presentation. We are welcoming any questions. If you could just type them into the Q&A box or in the chat, I will make sure to read them off for Paul and Kari to be able to answer. One of the first questions I have, though, just based off of your guys' presentation is, and maybe this just hasn't clicked in my head yet, though, but within the schools with the 4 school-based health clinics, how is it promoted, the clinic itself, to students, the student body, outside of like the marketing class and stuff like that, so students know that they can go there as a resource?
Great question, Abby. I think there's a lot of different ways that we try to get the word out. We try to partner with schools to have that be part of their back to school communication, so that every year that's another reminder. We often will have reminders at back to school nights and open houses. If there's conferences, sometimes we've had tables at conferences just as another reminder. And then we've also had some really good feedback from flyers flyers. That was one of the recommendations, again, from the marketing class, but having flyers on the back of the restroom doors, and really making sure that that's available. And then also doing education within the teachers and the staff, so that if they're identifying a need for a student, that they know that we're a resource that is available to help support that need. And then I would also just say the partnership we have with the school through the advisory meetings is also key to that, because we are working together to identify, are we continuing to meet a need? Do we have an opportunity to better meet a need? And they're also looking at what information do they might want to take from that meeting back to their teams to help support promotion or connection for students with the school-based clinic.
Yeah, and I'll add to that just yesterday, for example, I was at the STEP, which is the St. Louis Park Emergency Program. They have a back to school day where they collect backpacks and school supplies, and they give them to families in need for their mostly young kids. And so I was there sharing a table with Carmen, who is the St. Louis Park cultural liaison for the Latino community. And we're able to share information in Spanish about the clinic right there with kind of a target population that is maybe in need of those services. A lot of new to country families, for example. So that's another way we'll work. And that involves a partnership with another organization. So sometimes we'll go out of the school district to do that, but it's all in close partnership.
Thank you both so much, and I appreciate it. And there is another question here too, or I guess it's not a question, but a comment. Within Brooklyn Center Community Schools, we are so appreciative of the partnership and support of Park Nicollet. Thank you. From Deidre. Yeah, and I do have another question here. I just need to pull it up quick. The question was, can you provide any insight on the feedback that you've received from like caregivers and everything like that about their own experience with the school-based health clinics?
Sure. I think there are a lot of different probably stories that we could share with that. I think overall the feedback is that it feels very reassuring to them that they know that this is a place embedded in a school, which is often a place that they're already trusting, they're familiar with, they're going to on a regular basis, to be able to seek that care. I think we also know from previous stories and experiences of there have been some families that have actually chosen to remain in the school district they're in to help, because they're getting support for some needs that maybe they wouldn't have gotten support for otherwise. And that can be really important for student learning and development too, to have that consistency, as well as having care needs or medical needs met with that. So, Paul, anything you would add?
Yeah, I would. I had the wonderful opportunity to sort of do a tabling event in a community with one of our doctors, and I asked her like why'd you get into why are you doing this work as well as your regular practice? And she got real serious, looked right at me and said, Paul, this is why I got into doctoring in the first place. You know, being a doctor, I am just there helping the kids. And another story is how maybe a girl will come in just to seek some pregnancy questions and answers, and she might feel comfortable with having two of her friends come in with her. And in that setting, all of a sudden, our doctor is doing education for three kids, three students, and they're getting accurate information from a doctor and not social media, for example. And so, I mean, I believe that it makes them feel good, bottom line, and it's sort of the manifestation of health equity, because these are the same doctors that would be seeing, yours or my kids if we're on regular insurance, and they're providing care to kids who don't have those assets. So, I mean, that's one of my arguing points, is that it's the manifestation of health equity, and I think our clinicians know that, and they're proud to be part of that.
That's wonderful. Thank you. Another question is, are the clinics open every day, the school-based health clinics?
No, Kari, I can take that. We've got most of our clinics are open 2 afternoons a week. There may be a special time to do, say, a special flu clinic or an STD testing clinic, but they're 2 afternoons a week, usually either Monday and Wednesday or Tuesday and Thursday afternoons. And there's a blend of school time, and sort of after school time, so that people can come outside of those boxes.
Thank you. And then another question from Julie is, do you track average cost per student served? And if so, are efficiencies increasing or decreasing the longer Park Nicollet is in these communities? Thank you.
Kari, that's yours.
I'm happy to take that. I think we are continuing to look at that. We do look at all of the care needs that we are serving by kind of type of visit and understanding where opportunities are. I think some of the pieces that play a part into the efficiency component of your question can be related to other complexities of a patient population. So for example, I think Paul had mentioned if we are helping to support needs of a new family to the country, working through kind of what have they had from an immunization perspective when we're getting an immunization record that's in a different language, and having to understand what they had and update their record here and MIC and make sure that we are having everything ready to get them up for success and understanding what they are due for. So I would say there is a lot of learning. We are always evaluating to see how can we do things differently to try to increase the needs of the students that we are, or the volume of students we are meeting. And I think there are some complexities with the care that we are doing, that we want to make sure we are doing it accurately and well and giving good quality care for patients. And so it's always that balance of, we want to be efficient. We also want to make sure we're doing our due diligence to provide high quality care as well.
Thank you. And Daniel asked, do each of the centers have their own school nurses with whom you partner?
Yeah, our partnerships with the schools, there's usually one or more school nurses or a health manager for the district that will be involved in our advisory meetings and part of that leadership group for that clinic, so that they'll always know what's going on there and they'll always be able to share trends that they're seeing with the clinic. So the answer to that is yes. That's a school district staff person. And some of those look a little different in each community because like Kari said, some of our clinics focus a little bit more on the younger students and immunizations, and others are located right in the high school. So they may look a little bit different, but that's by design.
And I would just emphasize that partnership is really important. We're really grateful for all of the school partners, so appreciate the call out that we're getting to, but I think this only happens when we have strong partnerships all the way around. And so that partnership with the schools, and specifically the school nurses or student support services, is essential in us working together to best support student needs. So we are very appreciative of that. I think we work together really well. We, of course, have to make sure we're abiding by HIPAA laws for patient confidentiality and FERPA laws for our school partners with their confidentiality practices, but are just overall wanting to make sure we have really good communication and can best support the students overall.
Yeah, and I'll just add to that we're proud members of the Minnesota School-Based Health Alliance, and they represent all of the school-based health centers in Minnesota, and have been key to getting legislation passed in the state to define them and be able to bring more resources to them. And we're able to gain very easily from them best practices in working in close partnership with the school nurses and vice versa. So it's a very large asset.
Thank you. And Shauna had a question as well. She said, thank you for this great forum. What are some of the influences impacting sustainability, either positives or challenges?
Well, costs are going up for everything, and we have been providing these through 100% philanthropy since day one. We've gotten a little bit of government support during after the pandemic, and so just with the costs going up, we're still not meeting all the needs. I mean, we could always do more, and there's some things that we could bring in other resources to do. And like, I'd love to have vision care centers at at every one of our clinics, and instead of having to do more referrals into our just make it easier. We could reduce more barriers. We can do that. Um, but just with costs going up and the challenges of staffing, which Kari might be able to say more of, within our own clinics, we have to blend all those and make them work together. So those are some challenges. I think there's some positives in some renewed attention, or new attention for school-based health centers and their effectiveness within our agencies and organizations like that, both federally and within the state.
I would just add it, and I think this is a positive thing, but there is greater access to insurance than there was when this 4 school-based clinics started. And so I think it is an opportunity for us to look at who does have that access and how do we support making connections for them to seek out opportunities where there is access and be a connector and a supporter for that, while also being really good stewards of the philanthropic dollars to really help those dollars go further to impact the needs for those that maybe aren't having access. And so I think any shift is a shift and can be a change, but I think it also is stemming from also a positive thing, right? The needs continue to be high, but also access has improved in comparison to what it looked like even 10 years ago or 20 years ago, or more for some of our school-based clinics. So I think that's a positive thing for us to be able to look at and adapt to as well.
Well, again, thank you both so much for your time and amazing presentation. It's just, I mean, and maybe I'm a little biased since I work for the foundation, but I just think it's so cool how the school-based clinics are promoting such amazing health equity and increasing access and everything like that. And so if anybody has any other questions, please feel free to either email me directly or, and I can pass those questions on to Kari and Paul. But thank you all for your time. And I hope you all have a great rest of your Tuesday. Thank you so much, Kari and Paul.
Thank
Thank
you.
you. Thank you.
Have a great day.
You too. Bye-bye.